come up. Well, hello, everybody. Thank you very much for coming. And yes, it is a pity that we can't do this in person, but hey ho, here we are again online. So my name is Patricia, and I work in the Center for Aging and Dementia Research in Bangor. My background is as an occupational therapist, but in the last number of years, I've been doing research looking at mainly sort of the impact of neurological conditions on families as a whole. So I'm interested to see how illnesses such as dementia come into a family and impact every member of the family. So I've been doing that for a number of years. Today we're here to tell you a little bit about our little project in Brazil, collaborating with Brazil. So thank you all very much for coming, and I'll let Emanuela introduce herself to all of you.
Thank you, Dr. Patricia, for her partnership and for this webinar. I am an occupational therapist. I work with people with dementia and family caregivers at Federal University of Sao Paulo. Dr. Patricia and I started our work together in 2018, yeah? And this is just one of our projects together. During the webinar, we will talk about it, okay?
Wonderful. Okay, well then I'll start and I'll tell you a little bit what the plan for the day is. I can't move. Oh, there we go. Okay, so we're going to start a little bit. I'll tell you a little bit how I met Emanuela and how the links with Brazil started, just so you know how we got working together. Then we'll give a few facts about dementia, not only in the UK, but also in Brazil and in the world. And then we'll go straight to the point as to what it is that we've been doing together, the small research study that we've done to explore the experiences of dementia carers in the UK and in Brazil. And then finally, my favorite part will be showing you the short film that we've put together, where you can hear firsthand the experiences of dementia carers, both in Brazil and in the UK. So that's, I'm really looking forward to your opinion on that one. So I'll start explaining a little bit how the link with Brazil started. So initially, and funnily enough, I'm a marine scientist by background. My first degree was in marine sciences. And through that marine sciences career, I met Ronaldo, that is the gentleman with the pink shirt in that photograph. So through marine science connections, I met Ronaldo. But when I retrained and I became an occupational therapist and a health researcher, I said to Ronaldo, I have to come to Santos and I have to meet the team of health professionals and occupational therapists in Santos where you work. So I was lucky enough to get a little bit of funding from Bangor University to come and visit Santos. And during the visit, we did a number of things. We met, well, I got to meet all the occupational therapy students that Emanuela trained. So I got to learn a little bit about how the occupational therapy degree is organized. We then also did a small workshop amongst ourselves about Emanuela and other researchers in the department to see, kind of to compare facts and to see, kind of brainstorm about things that we could learn from each other. And we also kind of started thinking about what were the issues that we were interested in and what were the commonalities that we were finding in our work, both in the UK and in Brazil, with people with dementia and their caregivers. So that's how the collaboration started. And we'll tell you obviously where that went and how we developed that one in a little bit. But first, as I said in the overview, I thought it'd be a good idea to give you a little bit of a fact sheet of dementia in the UK. I'm sure it doesn't come as a surprise to many of you that there's around 850,000 people in the UK that live with dementia. But not only that, it's also that there is predicted, this number is predicted to increase to more than 1 million in the next 5 years and to more than 2 million by 2051. And again, I don't think this will be a surprise to anybody that most of those people living with dementia are cared for at home, supported by a family member or a friend. That is a very, very, very high percentage that are cared for somebody in their family. The total cost of dementia to society is around £26.3 billion. And again, I'm not big on numbers, but I think these numbers are pretty, show the picture pretty clearly. So 11.6 billion of this is contributed by the work of unpaid carers of people with dementia. And it's pretty shocking that this number is higher than the money spent in healthcare costs and in social care. So that kind of says it all and sets the scene for the UK really, really relying on dementia carers for the well-being of people living with dementia. I'll now pass on to Manu. She's going to give you a little bit of a background of dementia in Brazil.
Okay, I think it's very important to talk about dementia in Brazil because it's very different situation, yeah. And in Brazil, has been largely neglected in Brazil and the other Latin American countries, not only by policymakers but also by the general public. No current data on numbers available. The prevalence of dementia will increase 4 times by 2050 in Latin America. Brazil has the second highest age standardized prevalence of Alzheimer's disease and other dementias after Turkey. And I think it's very important to explain about our health system. In Brazil, the health system is called the Unified System of Health, SUS, is a public system, and it was created in 1990. Even so, care in dementia has many necessity to improve our care here. Currently, many countries have implemented the National Action Plan on Dementia or are in the process of implementing it. But here, nothing concrete has been done yet. And because this care in dementia has many weaknesses and challenges here. Those who can afford a private health plan do it. In this case, investment and training of professionals is necessary to more people are diagnosed early. Yeah. After this, it's very important to discuss about dementia in the world. The number of people with dementia globally is estimated to be 50 million. This is greater than the total population of Spain and is projected to nearly triple by 2050. Sustaining the health and capabilities of these dementia carers is a public health priority, né? WHO 2017. 5.2% of people over the age 60 are living with dementia globally. 58 of all people with dementia living in lower mid-income countries like Brazil. This will rise to 68% by 2050. Is a big number. Okay, Patrick.
So with that, with all that information and knowing a little bit how me and Emanuela met each other and how we started working together, I think the first thing we had to decide is we had to think, what is it that we wanted to find out in our first sort of work together? And I think one of the most interesting things that I experienced when I went to visit Brazil was I was lucky enough to be able to come to one of the support groups that Emanuela and Corina, another colleague, have organized in Santos. So I attended that support group, and obviously very quickly I realized that although there were things that I was missing because I am not fluent in Portuguese, I could very, very soon realize that there were many, many commonalities, and that many of the people with dementia and the carers that I was listening to in this support group were bringing out issues, and we're talking about challenges that I was already familiar with from having met many people with dementia and their carers back in the UK. So we thought, well, it'd be better to start with a clear and kind of simple question, although it's not simple at all, but trying to find out what is it that dementia carers in Brazil and in the UK have in common, and also what are the challenges they face. And obviously this would be regardless of context and regardless of many cultural, geographical, or economic aspects. So we thought, well, obviously the way to find this out would be to talk to people caring for somebody with dementia in both countries. It's not rocket sciences. We thought we need to find first-hand experiences in both, in Santos, which is a city in the south of Brazil, and then in the area that I'm familiar with, which is North Wales. And I guess before we continue talking about what how we set off to find out the commonalities between these two countries, we'll tell you a little bit about both of the settings where we did the study. So I'll let Manu explain to you a little bit about Santos, the city of Santos. There we go.
Okay, I don't know how many have heard of Santos, but it is a coastal city. It has good weather most of the year. The population in 2015 was 433,966. Okay. Um, it was voted the best city to live in for 60 plus by the Urban Development Index. The local government offers many free activities for the elderly, and this is a beautiful city to live, a good city to live. The elderly people like a lot living in Santos. Other places to know in Santos is the Port of Santos. It is the busiest container port in Latin America. It is an important gateway for different kinds of products in our country. And maybe as you know, football was invented in UK, and here in Brazil, it is the most famous sport by far. And here I put the photo of our 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 king Pelé, and maybe some of you know Pelé, the king for us, our best player ever. He played many years in Santos Football Club because he is from Santos.
Okay, so I do realize that most of the people that we have here with us today are from North Wales, but still, because this is going to be recorded and there's going to be hopefully people from further abroad listening to it. I'll give you a little bit of a quick overview of North Wales. I'm sure you can already kind of realize that we're talking about Santos, and we're quickly, or at least in my mind, I see Santos as an example of an urban context, an urban example of how you have high density of population, you have industry, and then we have the context of North Wales. So North Wales has a population a little bit bigger than Santos, but it's obviously distributed in a number of small cities and towns. So we could say that that North Wales would be our rural example for the small study that we set about to do. A high percentage of the population in North Wales also live in the countryside and in small villages. So that in itself is something that's very characteristic of North Wales, also because of that percentage, quite a significant part of them, of the people that live in North Wales, live in quite remote areas. So the way I call it, coming from a big city in Spain, is they live in the middle of nowhere. Many people in North Wales live in areas where maybe public transport is not that easy to get, and they have very little support networks immediately around. So maybe not, they don't live in neighborhoods surrounded by neighbors and other houses. It's also quite, the demographics of the population is quite old. And this is mainly because it is a very beautiful part of the country, and it means that it's quite a nice retirement choice for many older people decided to maybe leave the busy cities and retiring to a more peaceful part of the world. As well as being a retirement hotspot, it's also a place where mainly it's the outdoor activities and nature that attracts visitors. And obviously that also contributes to the demographics being quite different because of that. In terms of the weather, we cannot really say that there is very nice weather in North Wales throughout the year, but it's not very cold. So I've been reading a little bit about the weather, and the average is cloudy, wet, and windy, but mild. So we don't get too cold, which is a good thing. So I think we've given you quite a little quick overview of both places, Santos and North Wales, and I'm sure you'd agree with me that they are very different in many ways, but we can already find commonalities. I think you couldn't really think of two places that share and that have stronger differences. So we thought, okay, going back to the initial question, what is it that we want to find out from our work with dementia carers in both places? We thought, well, the best way is obviously to ask firsthand dementia carers to tell us a little bit about some of their experiences. So we set out the work in trying to organize two different activities that we would ask the dementia carers to get involved with. And we had a number of questions that we were interested in. So we wanted to see how dementia carers saw their role. So how would they define their role to others? And what does the role involve? What does it mean to their everyday routine? And what does it mean to their working life and their links with other people and social interactions? But also we wanted to know whether they feel supported at all. And if they do feel supported, where is it that they go for support? What types of support networks or support initiatives do they go to? And also, how do they deal with the challenges that they face? What are their coping strategies? What have they learned throughout the years of being a dementia care in terms of how can they get over the hurdles that are put in their way? But then the final question that we were interested in, and I think this comes from the fact that we're both Emanuela and I are interested in mixing disciplines and are interested in how we all interact with our environment and how our well-being is closely linked to what we have around us. We wanted to understand how does the surrounding environment play a role in the caring responsibilities. So both places, Santos and North Wales, have amazing outdoors, natural environments, but are these environments being used, and how are dementia carers taking advantage of those things around them to deal with their challenges? So the first activity we asked our participants to take part in was literally having a chat. We wanted them to have a chat amongst themselves about the issues that we just mentioned. You can see there in the pictures, we had two groups, one group in Santos and another one in North Wales, more or less the same number of participants, different ages, different life circumstances, but both of the groups were already groups that were that knew each other from before. So we didn't start anything from scratch. It was groups that had been meeting with each other before, so they already had a rapport between them, and they had and this was through the support group that they were already used to attending anyway. So during the chat, they discuss a number of things. Again, they discuss their beliefs, the feelings about their role, the perspectives of what the future holds, which was quite interesting in order for us to understand how they saw their role as carers being changing with time. But we also talked about, again, support networks, the natural environment, but it was a very free conversation in the sense that it was very much led by them. They kind of decided where the conversation was going to go. So Manu's going to tell us a little bit about the next activity.
My phone. Okay, in our two focus group, the family caregivers are asked to make some doodles so we can gain insight into their words. Here, language is no longer a barrier. It did not really matter the language spoken, whether English or Portuguese, but what they want to express. Yeah, and you can see in the pictures in Santos and in the UK. In the next slide, we just ask them to draw what their caregiver role could represent. It did not require answers to certain questions and were directed by those who participated. And it helped them to identify feelings and desires. And you can see this in the little video that we will show you. Okay. We okay. The next key. And after the result, the speakers was presented
Mm.
by Santos. Okay, can you hear me?
It's cutting a little bit. Try again, Manu. Mm.
Can you hear me? The
Yes.
activity proposed, we had these pictures, these drawings, and the first picture and the second drawings point out the relationship between the environment and nature. The third brings a person with confused thoughts, maybe. The fourth looks like someone in a lonely contest. And the fifth and the sixth, uh, we have portrayed the okay. In here, we can see the importance of nature and environment too. And maybe these things can be different in their role as caregivers. Yeah.
Oh, Manu, I think your internet. Hello.
Can you hear me, Patrick?
Now, yes.
Hello?
Yeah, I think you're cutting off a little bit. Shall I continue with the next one and then see whether your internet gets better? Yeah.
Okay, I was talking that in this slide,
Okay. I'll. So what Manu was showing us here is the doodles that many. Oh,
see the importance of nature and environment too.
yes. Oh, thank you, Manu. Thank you. I think you're cutting a little bit, so I'll try to sum up what you were saying about the doodles. So I think you could all see from the doodles that there is a lot of nature connections and there's a lot of family relations that come across in the doodles. It was a very open activity. No one had to doodle anything in particular. Some people decided to draw things that you can identify. Other people literally did doodle and did made shapes. So it was a very open activity. And as Manu said before, it was a medium through which people could communicate feelings that maybe were not easy to communicate otherwise. But it was also a relaxing activity that made people chat amongst themselves whilst they were doing it. So I think we won't wait much longer. The bit that Manu and I are very excited about showing to all of you is how we put together a little short film where Brazilian and British carers themselves share their thoughts on what it is like to care for someone with dementia on opposite sides of the world. So what I'll do is we'll go straight away to show you the video. It's approximately 13-14 minutes long, and we really hope you enjoy.
Quando eu estou na paz de espírito, Esse emocional também deve ser porque também da idade, mas...
You can skip over to somewhere else.
And you don't want to accept that. And then it's like a cycle that's going on. And then the deterioration starts. And you don't want to accept that. And then it's like a cycle that's going on every 3 to 4 months. I mean, he'll never be the way he was, we know that, but there are these glimpses. And I feel that, to be fair, because as everybody knows, it does upset me what's going on. But I don't enjoy what I should be enjoying.
O problema era meu, eu que queria outro diagnóstico, queria outro médico, queria alguém que achasse que não era isso, que era uma outra coisa. E aquele dia que ela falou, tudo que ela pontuou está lá. O diagnóstico é muito semelhante a tudo que ela disse e os remédios que ela apontou são os remédios que ela toma, ou seja...
You know, it's life, and you listen to everybody around and you just think, well, everyone's crying in their own way, and most of it is because you've lost that person that you knew, you know.
O mais difícil é lidar com o fato de que é uma nova vida, que não é uma vida como era antes. E lidar com os sentimentos que vêm de tudo que está no passado e ter que...
Vai aflorando...
E ter que lidar com eles e ver que é um outro momento. E que é um momento de atenção e dedicação. Minha mãe cuidou dos meus filhos, foi ela que ficava com os meus filhos quando eu trabalhava. Então isso é um lado que tanto eles quanto meu marido reconhecem profundamente.
Sometimes you think it's like being with a stranger, not quite a stranger, but you're just sharing a house and having to look after someone, and it's just, you don't have that link and they don't get what you're saying, and they forget so much of your shared history. I think that's the biggest thing, isn't it? Huge things that have been forgotten about. If you talk about something and it's completely blank about even your own wedding, or he can't remember anything much about all that time.
Eu acho que essa coisa de entender que a pessoa que você tinha não tem mais, que é uma outra pessoa, e que a gente tem que ver como é que vive com essa outra pessoa, é o mais, eu acho assim, é o mais difícil, a questão da dificuldade. Mas aí, como é que primeiro a não aceitação dela também, né, de uma pessoa que a vida inteira não tinha nem diarista, imagina o que é você ter pessoas cuidando dela. Isso foi um processo muito complicado, muito difícil, mas o mais difícil era eu aceitar que eu tinha que fazer isso, porque senão eu não ia dar conta fisicamente. Eu fiquei bem física e emocionalmente nos 5 primeiros meses. Aí começou a pifar.
There is no training course. There's no manual you can read to say, right, this is the way it's going to go. And there's no time as to how things are going to progress.
E eu tenho a felicidade de só virar o quarteirão, é atrás da minha casa. Então eu estou praticamente todo dia com ela. Às vezes, o cuidador também, eu estou falando do apoio não só moral, como também financeiro, e ninguém se tem apoio. Então você se vê perdido.
Over time, once diagnosis happens, you start taking on both roles, because you have to take on both roles. So all of a sudden, some of the things that Jill would do, like working the washing machine, I have to learn. Okay, and you know, and some of that is easy, and some of it is not so easy. But eventually, what you're doing is you're taking on 2 jobs at the same time that you had to do one job. So the amount of time you had to do things that you wanted to do for yourself is diminished, and it does become a 24/7.
Eu não consigo, então é um desafio assim para mim. Não consigo dormir, porque eu tenho medo de que ele vá para a janela, já que eu aqui nos termos, tudo. E assim, eu assim, não sei como agir. Eu acho que quem está mais, estou precisando muito.
I think energy levels can drop, and it does get very, very tiring, because I think at times it seems relentless. I wake up in the morning very early and I mentally plan the whole day as to what I'm supposed to do, and a lot of those things can't get done because it's impossible to do all those things in a day, so they roll over to the next day.
When they're diagnosed, you suddenly get this almost overpowering feeling that I'm responsible from now on.
Estressado, apavorado, porque eu só vi um caminho, colocá-la numa clínica. E aquela sensação de abandono, nossa, isso é terrível.
A few weeks ago, I was ill, and I couldn't go to my husband, and that was painful. I had to get help, and you have to go at home. So I was too ill to look after him, but then he ended up in hospital. But I felt I'd let him down.
Ela não quer tomar banho com ninguém, ela briga, ela faz aqueles escândalos. Aí já sobe o negócio de raiva. Meu Deus, tudo pra mim, né? Aí eu contrato alguém para ir pelo menos 1 ou 2 dias na semana para eu ter essa folga. Não tem jeito, eu fico mais nervosa ainda.
Sim, é uma luta de sentimentos. Tem hora que você tem sentimento, você tem pena, você tem aquela piedade, chorei muito por pena, por olhar aquela pessoa. Tem hora de revolta, não contra a pessoa. Digo para vocês até, eu sou uma pessoa espiritualizada, eu me acho, mas teve momentos de revolta contra Deus. Por que permitiu? Por que existe isso? O que eu fiz? Essa pergunta, eu não sei se você fez para você, mas eu fiz várias vezes para mim.
Eu entendo que ela não consegue entender, né? Que ela está... Mas assim, por eu estar na situação que estou, né? Porque não adianta, eu tenho que tomar conta, né? Porque é o meu período, enquanto eu não tiver outra pessoa, eu tenho que tomar conta, eu tenho que fazer as coisas, né? Isso ainda me faz saber eliminar essa raiva.
He cares for us.
De achar tempo para cuidar de você, para você ir ao médico, é muito difícil. Foi onde eu encontrei muita dificuldade. Só eu e ele. Como é que eu vou ao médico? Como é que eu vou cuidar de mim? Como é que eu posso ir no salão arrumar um cabelo? Não posso levar.
It's great, you know, you must be doing a really good job. I think, yes, I am, but at what cost? And no one, or it very rarely, says to me, how are you doing, how are you feeling? Because they want you to feel okay. And like David says, you don't feel right saying to your children, I'm getting really tired and I'm feeling a bit desperate about this, and they'd rather not know it because they've got enough on in their lives.
Eu preciso dormir, eu preciso descansar. Então assim, falava, mas poxa, vai lá cortar o cabelo do
So when we really should be going to the doctor, we probably don't go to the doctor, we put it off. And that then leads us down the track of almost crisis management. We hit a crisis where we can no longer cope. And I can always phone her up and say, come and look after your mum for a minute. But it's a feeling that I don't want my children to become carers.
Meus filhos, graças a Deus, eu só posso falar bem deles. Um é adolescente, o outro tem 24 anos, mas eles, dentro do que é possível, eles me apoiam muito, mas tem a vida deles, né? Enquanto eles estavam de férias, foi uma coisa. Acho que aí que eu comecei a pifar. Assim que eles saíram, voltaram para as atividades deles, aí fiquei mais só ainda, né?
They've got hundreds of friends. He's got 2 friends that come every week, and I'll never forget that. I'll never forget that. He's got other friends who are too upset and don't come. In my eyes, that's weak. If you're a true friend, you stick with them thick or thin, but they can't handle it.
Então, realmente, os encontros, para mim, foram assim, fabulosos, né? Uma era a questão da terapia, outra a questão do conhecimento da doença, outra é o tempo para a gente, né? Então, acho que foi, assim, de super importância, realmente. Eu tenho que realmente agradecer mesmo.
Os encontros que a gente tinha aqui, realmente, para nós, aquela sensação de que estou indo para uma festa, hoje eu estou viva. Essa sensação que a gente tinha, eram as quartas-feiras que a gente tinha de vir para cá, como se a gente estivesse realmente indo a uma festa, que era um tempo que a gente estava tirando para Teve que dar um jeito. Ah, não pode ficar sozinho, mas todo mundo deu um jeito e veio. Então, eu consegui realmente, por isso que faz bem. E assim, eu tenho as minhas fugas, o que eu faço na hora do estresse? Eu vou brincar com as minhas plantas, eu vou mexer em plantinha, eu vou replantar, eu vou fazer muda, é o que eu faço na hora do estresse.
Mas o fato de você estar na praia, pisar na areia, pega ele, vamos lá, pisar na areia, agora vamos andar lá, água na canela, sabe, bater aquele ar, vamos escutar aquele barulhinho gostoso do mar, na onda, né? Isso aí é de graça.
Relaxante.
E é relaxante, né? E é de graça, né?
Sentamos na praia e ficamos vendo o mar, ficamos vendo os cachorrinhos falando. É um momento de paz que eu para ela. Isso foi uma surpresa para mim. Ela nunca, imagina, minha mãe. Você imagina que ela gastar meia hora parada na praia vendo o mar. Então isso é uma coisa boa desse outro momento. É uma coisa que jamais ela faria e que ela só está fazendo porque ela está doente.
A gente tem, eu pelo menos vejo a oportunidade de, como ela me criou, eu podendo dar o retorno, isso é muito gratificante.
Mas pelo menos esse tempo que tem, que a gente não sabe o tamanho, você proporcionou o melhor. Porque para você estar bem, você tem que proporcionar o melhor. Senão você não vai estar bem também. Então, o tempo é curto, é limitado, então vamos proporcionar o que a gente pode de melhor.
Okay. Well, thank you very much for watching that short film. I've watched it many times, but it doesn't matter how many times I watch it. I always find new things or new, yeah, it's just very, very, very touching, I think. And it's just very touching the way everyone expressed their opinions and spoke from the bottom of their heart, really. So obviously, watching a short film like that, where you're listening to people's experiences firsthand, brought a lot of food for thought for me and for Emanuela. So we want to think about, okay, what can we do? What does this make us think about how we can move forward and maybe move on in trying to understand how culture plays a role in the role of dementia carers. So yes, that's one of the things we're interested in, because obviously it doesn't really matter how far apart people are and how geographical situations are different, economic situations are different. There are very, very strong things that bring together all dementia carers in different parts of the world. And we can all learn from each other. And there's obviously a very strong impact of peer support. So in this very small little kind of research study that we did, we knew that peer support obviously has a benefit at a local level, and that people really benefit from sitting with others and talking about anything they want to talk about, people that share their experiences. But I guess with this little activity, we also realized that sometimes you don't need to be in the same room with someone to share experiences and to actually feel that you're benefiting from listening to them. So how can we move on and maybe develop new ideas in terms of peer support across different countries? Now that we're also used to online technology, we're all kind of adapting to online in a way. We're much closer than we used to be before COVID. So if there's been any benefit of COVID, we would say that we all feel a little bit closer due to technology. So how can we maybe use that for the benefit of people living with dementia and their carers? But also, it's interesting how the natural environment was mentioned quite a lot in the conversations with carers, how the concept of sitting by the beach, just watching the world pass by, was something that benefited the mum of one of the dementia carers that was speaking in the video. And how, as one of the dementia carers was saying as well, it is free. Some of the outdoor environments are free. You only need to go and sit in the beach and benefit from it. So we want to explore these things a little bit further, and we want to work, as I said before, in a more mixed discipline sort of way. So not thinking, okay, psychologists look at psychology, health researchers look at health, and environmental ecologists look at environmental ecology. We have already started creating a network where we work with other departments, people that are biologists, conservationists, trying to see where we can move forward with this and get Santos and Bangor to work together to develop ideas in which we use the natural environment around us to benefit people with dementia and their carers. So I won't speak for much longer because we want to have time for some questions if there's any. But I guess I'll leave you with the sentence, I think, that for Emanuela and I is kind of the logo of this work, which is that across the world, those who care for a loved one with dementia share very similar challenges. Dementia is definitely a global challenge, and we shouldn't think that we can't learn from other countries. I think the opposite. We can all work together and learn from each other in our different experiences. And I think that would be the message that I would stay with. And we would like to say thank you very much, obviously, to all the dementia carers that share their valuable experiences with us. They did it in a really enjoyable way. With a sense of humor, they all got involved, and that was really, really, really appreciated. But also people like Gweno Davis from Crossroads Care Services that obviously opened the doors to her support to the group of dementia carers that she works with. Catherine Head Jones from Bangor University that helped a lot in terms of thinking about the study, organizing things, linking us with the right people. Corina Lopez is one of the psychologists from Santos City Council, and she helped Manu in all of the focus groups and contributed in a very important way. And then Lisa Carter Grist is a local artist from North Wales, and she's the artist that helped us think about how to run the doodle session. So she's done work like that before, and she was really, really, really helpful. And Stephen Holston, who did the painful job of getting this film together. It took quite a long time because of COVID and everything, but he was very patient. He worked really, really hard. So thank you very much to him for putting the film together. We had loads of hours of going back and forth. That's it for me. Manu, do you want to say something before we start the questions?
Yeah. I need to say that I am very happy with this webinar. I am very happy with these challenges in our life, in our job. I'm very happy to work with Patricia. And after, for the people that live in Brazil, I will do a webinar in Portuguese, and we have other time together, okay?
Okay, so I'm just trying to look. Thank you very much, everyone, for your comments on the chat. It's nice to see that it's not only Emanuela and I that think that the short film is quite insightful. Let me see. Thank you. Very nice comments on the chat. Thank you very much.
Do we have questions there?
I can't
The
see any
chat box?
questions. We're just waiting to see.
So we're just waiting to see if anyone wants to put any questions in the chat. Please do so. Oh, we do have a question actually that was sent in. Let me just see if I can find that.
Oh, thank you. So yes, so Kim, if you can find a question, or if maybe the person would want to unmute themselves, it's up to them. No problem, either way.
Let me see. It's coming up as P. Sir on here. So do you want to ask your question?
Hello.
Hello.
Hi.
Hi. I had asked. This is Purvali here. I'm in India. Hello.
Are you? Yes.
Hello. Can you?
Yeah, we can hear you. Go ahead. Thank you.
That was a very nice program. Thank you. I was wondering whether people anywhere, I mean, people in Brazil or in Wales, more likely in Brazil, faced economic challenges which could have been addressed by coming closer to the culture.
I'm not sure I understand, but I think one of the things that I was very surprised about when I attended the support group in Brazil when I visited there was that the carers for people with dementia that I met in the support group, they were very curious and they were asking me questions about the UK, but I was surprised that none of the questions were in regards to economic circumstances. So they were more interested to find out, for example, in how the families organize themselves to care for the person with dementia, whether they feel lonely as well. They would say to me, are there support groups over there? But I was surprised that the sort of the questions that would have been, maybe I would have assumed were going to be more likely, or do the people in the UK have more services, more resources? How does that help them? They have more hospitals, whatever. But that never came up in during the groups that we recorded. That is something that didn't come up either. I think the challenges are so deep and so whole-centered that things to do with the actual socioeconomic status didn't seem to be very vital for them. Saying that, I'm sure we would need in a review. Right.
Yeah, I mean, when I mean, the kind of culture in the UK and the kind of culture in Brazil, I don't know how similar or dissimilar they are, but there is a huge cultural factor in caring for people with dementia, and I think what forms of entertainment might be available, or what environmental modifications might be available to a person in the UK might not be available to someone in Brazil, but there would be cultural aspects in Brazil, you know, things that person has grown up with, which made them Brazilian. And if they could come close to that, it could sort of improve their experience of dementia, perhaps by, you know, bringing them closer to a feeling of home, a feeling of familiarity, which they would be missing in trying to catch up with something which is more developed, they feel, but it'll, you know, it's not really working because they're already in the middle of this disease, and it's not yet completely sort of set up probably in Brazil. Of course, I'm talking this without seeing or knowing what is available in Brazil for someone with dementia, what you know, and how the care system is in Brazil. So I feel that it's very important to preserve culture and to address that side, that we need it for aging, we need it for people, for this growing population of people with dementia, not just the elderly. And it's important, and I think it is important to bring that forth to the world, that it is important to preserve culture as well.
Yeah, totally agree. And I think
It saves money as well. It saves money as well, doesn't it?
Definitely. And I think what you say kind of links a bit with what we were saying at the end, that we can all learn from each other, but it doesn't mean that we have to surrender the cultural differences that we have. We can learn from them, and actually it can go both ways. So yes, I think in the work that we're planning on doing, we need to unpick all of these issues and benefit from the learnings from both cultures, for sure.
That's right. That's right.
Thank you very much. Manu, sorry, if you want to add something.
Thank you.
No, I am thinking about her discuss, and I think here from us in Brazil, the big challenge is about a plan action on dementia, because we don't have yet nothing, and learning with okay about it, and learning how can improve, or how can implement the plan action on dementia here, because I think the culture and the environment is important, but if the people don't have awareness, don't have access the services of health, don't access of knowledge, we cannot have the community aware more aware in dementia. And after this project, our next step is work with University, Federal University at Sao Paulo and UK Bangor, Bangor University, to learn about dementia-friendly community and see the environment, the community, how the people that live in UK live with this disease, live with this possibility, what the community can help. And after this, I will bring this project, dementia friendly community, dementia friendly, to Santos, and I think we can improve the awareness in dementia here.
So I think, Man, I think you've answered the question of Holly, that wanted to know where are we going from there, from here. So yes, as Manu said, Manu's starting a project where she'll be working and kind of picking the brains of the people in Bangor University who have worked to make Bangor University dementia friendly. And then hopefully we can use the learnings or her experience of talking to people here in Bangor back in Santos, in UNIFESP, in her university in Santos. So that's one of the things that we're starting pretty imminently. Manu is doing that work. And then, as I said, we're trying to build a network that is called, that we're calling an interdisciplinary One Health network. And that has a mixture of Brazilian colleagues in many disciplines: conservation, ecology, health, sports sciences, medicine, with colleagues here in Bangor. And we're trying to answer global challenges, but from a multidisciplinary sort of lens. So we will be looking at how we can learn from each other's experience of raising dementia awareness, but involving ecologists, environmentalists, and trying to work in that way. So that's early stages, and with everything, it's all funding dependent, but that's the way we're thinking this can progress. So we definitely don't want to just leave it here. We want to, I think we will have plenty of future possibilities.
That's brilliant. Thank you so much, both of you, for coming on and doing the webinar today. And we really look forward to hearing where everything goes. And hopefully you can do a follow-up webinar once you progress even further. We are going to have to call it a day now because it is just past 4, and I'm aware that we did tell everyone that it was only going to be a 1-hour session today. But if anyone does have any further questions, please feel free to send them to us by email. We've also put the evaluation form into the chat box, so if you could fill that out, we would be eternally grateful. And we will see you next month for our next webinar. So thank you again, both of you. It's been lovely to see you, and we will see you soon. Take care, everyone.
Thank you very much. Thank you, everyone, for coming.
Thank you a lot.